On the occasion of World Hypertension Day today, we are privileged to have with us Dr. Shirish Hiremath. Dr. Hiremath is the Director of Cath Lab, Ruby Hospitals, Pune. Thank you so much for joining us, Dr. Hiremath. What is the best way to take blood pressure? A lot of us also have these blood pressure machines at home. Can we depend on those? And what is the right way of taking blood pressure?
I think this blood pressure measurement at home is very important. Earlier, we used to have a mercury manometer in the doctor's office, and everybody used to get a blood pressure checked on those. Mercury is considered hazardous to the environment, and it's out of style. So today, we have these blood pressure digital readouts which come on the machine. So if you're in a hurry, you should never check your blood pressure. I think you should be a little bit quiet, sit down in one position, and you place your hand on a table, like a dining table height, so that the hand is on the same level as the heart and the shoulder. So if keep your hand like this, and then try the manometer cuff, and then everything is automatic. So you should be relaxed. You should be sitting in a chair. Keep your hand horizontal, and then everything can be correct.
Okay. Thank you so much for that. I think it's going to be an effective method of checking blood pressure at home, because a lot of us tend to make small mistakes which affect the reading then.
Yes. The important thing is, if you go to a doctor's chamber, so many times just getting into a doctor's cabin produces some kind of anxiety, and probably the blood pressure tends to go up. So we give a lot of importance to this home monitoring of blood pressure, HNBP as we call it. So if I have somebody who is at 2 reading which are touching 140, I will ask them to check at home many more readings. If these readings are also 140 and maybe above, I think I start believing that he has blood pressure, and we need to be looking at blood pressure effectively.
Okay. What do these terms mean, doctor? Commonly used CVPM, HBPM, ABPM. What do these mean, and how important are they in checking blood pressure?
I think ABPM is ambulatory blood pressure monitoring. That means we have an instrument. You try the blood pressure cuff. All the gadgets, wires, they go into a small transistor-like tool. You can clip it to the belt, and the patients can sort of move out, do 24 hours program the way he normally does. The apparatus can be programmed. We can tell the apparatus to check blood pressure every 5 minutes, every 10 minutes, and so on. So majority of us will program the blood pressure apparatus to measure very frequently in the daytime. At night time, we reduce the frequency, say every half hour or something like that. So at the end of 24 hours, we have, say, 200 readings in front of you. And then you also get an average reading. So you sort of mix and match and try and see out of 100 readings, how many are going above 140. Then you count down to, out of 10, how many are going to above 140. And likewise, if many readings are above 140, it is diagnosed as hypertension. The ambulatory blood pressure is important because you're allowing the patients to have his readings at home, patient's home, when he's probably very relaxed. It also allows blood pressure reading when some of the most tense moments in his day, like if he's in an argument with somebody in his office, even then the readings are being taken. And also at nighttime we have something what is called as a nocturnal dip. That means if your blood pressure is at a horizontal level, after 12 at midnight, there is a drop, and that drop persists till about 5 a.m. So if somebody is missing out in this nocturnal drop, blood pressure is remaining flat throughout the night, this is also considered to be high blood pressure. So loss of nocturnal dipping, as we call it, is again a marker that somebody needs blood pressure care.